Hi, and welcome to LorneBrown.com. I'm your host, Lorne Brown. I'm a doctor of traditional Chinese medicine and a clinical hypnotherapist, clinical director of AcuBalance Wellness Center. And today we're going to talk about anxiety with the Anxiety MD. And I want to introduce you to Dr. Russell Kennedy. Now, he's kind of a rare bird among physicians in that he specializes in the very disorder he himself suffered from. He developed anxiety as a result of growing up with a father with severe schizophrenia. And his life work has been devoted to showing others that we do not have to suffer from chronic anxiety as he did, which is a blessing because I know it's rampant now in our society. So you, Russell, in your book that we're going to talk about, perfect timing. Now, Dr. Russ, as many people know him in his circle, has degrees in advanced training in Western medicine, neuroscience, and developmental psychology. But it's not all science when it comes to Dr. Russ. This is where he's got the yin yang going on. So we talked about the neuroscience and the Western medicine. He's also a certified yoga and a meditation teacher. You think that's enough to take him on to the left side. He's also a stand-up comedian. I don't know if I'm sitting there as a patient. I wonder how that goes over for your patients when you make those jokes. Probably eases the situation. Now, whether we're going to talk about the latest in neuroscience or it's living for Russ at a temple in India, or examine his own anxiety, his own anxious mind with psychedelics, Russ has seen anxiety from multiple perspectives, notably as both as an anxiety doctor and himself as an anxiety patient, which is really why he wrote his book, The Anxiety RX, or Anxiety RX. And for our listeners in Australia, RX is shorthand for prescription. So anxiety prescription or anxiety RX. And he's going to share his understanding treatment of anxiety never seen before. And please do pick up a copy of his book, Anxiety RX. Russ, thanks for being here. And I want to get right into it. You got both sides going on, the neuroscience, the medicine, you're a comedian, you're also a yoga meditation teacher. So when we chatted in the past, you talk about how anxiety has more to do with the body than the mind. And that, to me, sounds like you're going more to your roots in meditation and yoga versus neuroscience and medicine. But can you explain what you're talking about with anxiety in the body more than the mind?
Yeah, I think what we do in North American society is we treat the anxious thoughts of the mind as the problem, when actually the problem, the way I see it, and the way I've seen it on psychedelics, examining my own crazy mind, is that it's a trauma that we hold in our bodies, typically from childhood. It can be PTSD as well, but typically from childhood, unresolved trauma that gets stuffed into our unconscious, and the unconscious being a representation of the body, or the body being a representation of the unconscious mind. It gets stuffed down in there because when we're a child, we don't have the wherewithal to be able to deal with the traumas that we're faced with, abandonment, loss, abuse, neglect, rejection, growing up too fast, maturing too soon. It's too much for our child mind. So what happens is that energy gets offloaded into the body to allow our child mind to think and process information. But there's a time limit on it. And usually around, 20, 30, 40, typically 40 or 50, the wheels start to come off. And that old trauma starts to come back up again. And it shows up in the mind as worrisome, as worry stories, because that trauma gets read by the mind. The mind is a meaning-making, make-sense machine. I'm a neuroscientist. I've studied the brain for a long time. But the thing that I notice the most about it is it has to make sense out of everything. So when you feel this old trauma energy in your body and it feels uncomfortable, your mind makes a corresponding story to go along with the discomfort that you're feeling in your body. So when you feel this alarm, I call it, in your body, the mind interprets that alarm and makes an alarming story about it. It's not going to make a story about, kittens, puppies, and picnics. It's going to make a story about, oh my God, what's going to happen next week? What's going to happen tomorrow? And then the body reacts to that story as if it was really happening. So then the alarm gets ramped up. And when the alarm gets ramped up, we get dropped further into our survival brain, which doesn't allow us to see rational thought. So now what was just a worry that seemed kind of way out there now seems rational, because our rational mind, the blood flow, we're losing our blood flow to our prefrontal cortex. So we're not able to discern this lie, this worry, from the truth. And then when we believe our own worries, the alarm just gets ramped up in our system. So we get what's called the alarm anxiety cycle, which is basically what I wrote the book on, and how we have to divide anxiety into two different components. There's the anxious thoughts of the mind, which is what anxiety is. And then there's the alarm, this stored alarm, this old trauma that's never been processed in the body. And if you try and treat them both at the same time, they're all kind of jumbled in there and you never get an entry point. But if you can separate the anxious thoughts of the mind and deal with them separately, and this alarm in our body and deal with that separately and stop them, you stop that reverberating feedback loop that just keeps making each one worse. And then when you break the cycle, you can actually see it, so you don't have to be it anymore. So that was a rather long introduction, but hopefully that gives you a little background as to, kind of where I'm coming from. So it's a very atypical process because most of the Western medicine assumes anxiety is in the mind. And yeah, it's reflected by the mind. I'm not saying the mind doesn't play a role in it, but I'm saying that the real root cause of anxiety is this alarm, this old unprocessed trauma that was sequestered into your body, usually from childhood.
And when you practiced as a physician, did you see results using like pharmaceuticals? Did you get short or long-term results? And I'm assuming you saw that there could be another way to do this, hence you wrote the book. So how's your approach different than what you used to do, for example, with pharmaceuticals?
Well, I had to get out of allopathic medicine because, one of the things that I've had since I was a child is this kind of clairsentient ability. I can read energy in people. And so I would get someone coming into my office in a clinic in downtown Vancouver, and she came in, for a bladder infection. But I can see into her, and I know this sounds flaky, and as a Western medical doctor, I want to have a seizure when I say this, but I can see that she was abused as a child. I can see it. I can almost see what she was wearing. I can see the age she was. Now, I can't bring that up to somebody who I've got, a 10-minute visit with in a downtown Vancouver clinic. So basically, I give her, Bactrim or one of the antibiotics and pretty much send her on her way. But after doing that for a long time, I got completely burned out. So what I'm realizing now, that because I retired from medicine officially in 2017, and now when I talk to people, I can take my time with them, because I think that's the mistake that a lot of people make with anxiety is they unearth some stuff, but rather than just allowing it to sit there and process and allow that alarm to bubble up to the surface so we can do something about it, the next cognitive piece is put on there. So it's like, yes, you were beaten by your dad. Now sit with that. And then they sit with it for like 5 seconds and then they go on to the next thing. And really what I'm finding is that, you've got to sit with people's traumas for, 2, 3, 4, 5 minutes and allow it to settle out, allow them to find where the alarm is in their body and then connect with that. Because what all worry is basically a distraction that sucks you into your head, that pulls you away from this alarm that's uncomfortable. And that alarm probably represents your younger self, a point in your life where you felt uncertain, and you go right back to that. And if that's where we're resonating from, anything that happens, around with COVID or any of the stresses will kind of transport us back. We'll go into an age regression and we'll go back to that same level of competence we had when that trauma started. So if you're 8 years old and, your mother was an alcoholic and you came home and you were in shock, essentially, part of you will go back into that shocked 8-year-old. So with me, I need to sort of sit there with that person and allow them to feel that and go through it. And you bring up medication, often medication numbs their ability to feel. And that was one of the big, I wasn't so much worried about antidepressants when they didn't work because it allowed people to do their work. What I worried about was when antidepressants did work. Because when they did work, people just didn't have any desire to work on their old stuff. So that's the problem. And I'm not against medications. I am absolutely not, because I do think they are life-saving in critical, acute situations. But I think when we see our doctors, because typically GPs aren't trained in psychotherapy, and they only have 10 minutes with each patient. So their go-to is really to give you a prescription. So I tell people, don't go to the hardware store looking for peanut butter. Like, don't go to your GP looking for counseling because they're not trained in it. And, likely what they'll do is give you a prescription.
And to lead on that, or to follow up with that, so how do you think practitioners can have better success in working with people diagnosed with anxiety or worry, or as you call it, alarm? Is there an approach that you have found effective for yourself and the people that you're coaching, counseling?
Yeah. I mean, I get people to find where their alarm is. Usually what I'll do is I'll get people to go back into one of their old traumas, not their number one trauma, but I'll say pick something that really bothers them. And maybe I could do it with you for a sec, Lorne, if you're game.
Sounds
Pick
good.
something that stresses you, that causes you, discomfort. Don't pick the worst thing in the world, but pick something that's uncomfortable for you. You don't have to tell me what it is, but just bring it to mind. Now,
Okay.
where in your body do you feel that? Okay. Now, does it feel hot or cold?
If I gave it a temperature, intuitively, it seems like it's probably a little on the warm side. Doesn't feel
Okay.
hot, but I would say maybe warm.
Does it feel sharp or dull?
Dull.
Does it radiate anywhere? Is there a pressure? Does it push up? Does it push down?
Mm, I would say it's probably maybe a bit of a tightness from the throat down to that lower part of the um, near the heart area, the sternum.
And does it have a distinct boundary, or does it kind of just slowly kind of diffuse into the area of the chest?
It's the area of the chest, front to the back,
Okay.
and it doesn't go all the way to the width of my torso.
And does it seem kind of consistent, or does it seem like there's something inside of that boundary that's like a white hot center, or is it just more consistently a pressure?
Consistent.
Okay. So that is probably your younger child. That's probably your inner self, or your young inner child, or whatever you want to call it, asking you for your attention. So what we do, or what most practitioners do, is they talk about the reasons why. I'm stressed because my wife, doesn't listen to me, or I'm stressed because, my husband is out of work. Really, you're stressed because your old alarm response has lit up and you got stuck in your head. And when we get stuck in our heads, if the problem is here and we're up in here, and I'm making the crazy simple on purpose, how much healing do you think is going to get done down here if we're up in here all the time? And that's what worry is. Basically, worry is this distraction from this alarm. So the number one thing that I tell people is find your alarm. Close your eyes, think of something from your childhood typically. And again, don't pick the worst thing about your childhood, but something that stresses you. And then just go into your body and see, does it have a color or a texture? And again, as a medical doctor, I feel like I want to kind of throw up when I talk about this stuff, because it's so strange from the way when I was trained. But it's so effective, because the problem isn't in your thinking. The problem is in your feeling. And you can't fix a feeling problem with a thinking solution. You have to meet that alarm on its own level. And that's the level of feeling. And when you get to that level of feeling, you got to spend a little time with it. And the last thing that I'll add to that is, don't try and explain it right away. Like, don't try and go, okay, well, I mean, once you've got the description of it, fine. But just sit there and just try and feel it. One of my favorite little mantras in this sort of situation is sensation without explanation. So you just feel it. And you just examine it and try not to make sense of it, because your mind will compulsively try to make sense of this feeling. And when it does that, it takes us away from the ability to integrate it or resolve it. Daniel Siegel talks about this, and he talks about integration being the resolution of disparate parts that come together into a functional whole. So if we've got these disparate parts, this alarm that keeps flaring up on us, and we keep going to our thoughts and assuming our thoughts are what's causing the problem, we're never actually going to fix what the problem is, which is this sense of alarm that's buried in our bodies and probably has been buried there since we were kids.
Chinese medicine has this beautiful expression, before age 35, disease cheats you. After age 35, before age 35,
Yeah.
it goes this way. Before age 35, you cheat disease. After age 35, disease cheats you.
Yeah.
And it reminds me how you say, as a child, you kind of just put this aside, bear it in the cells of the body so you can function as a child. And then an age comes, you said 30, 40, 50. So an age comes where you just can't push that beach ball any further underwater. And it just says, now we're going to deal with it. You're an adult. but it's the inner child saying, now you're going to deal with me. There's that part of you. That's what you're seeing, right?
Yeah. And it comes out in your body. It comes out as premature arthritis. It comes out as adrenal fatigue. It comes out in all these different ways. And really, it's just you trying and keep pushing. Like, here's the way I like to explain it. So your alarm is like your younger self. So if you had a child come up to you and put their hands up, like pick me up, and you said, no, I've got to do Facebook, or I've got to distract, or I've got to go online, or I've got to what do you think that child's going to do? They're going to yell louder, for one, and then they're going to give up. So a lot of us wind up as children, if we have childhood trauma, a lot of us gave up. And then that trauma gets buried deeper and deeper and deeper. And then it does come out when you're older. And the analogy that I kind of draw is like, you've got a hole in your boat, right? The hole is the alarm. And there's water rushing in. Now you can bail that water out, which is kind of like fixing the thought processes, but you still got a hole in your boat. So if you have to fix something, fix the hole in the boat, fix the alarm, connect with the alarm, connect with that younger self, because that's who's upset. Adult you isn't upset that much. I mean, of course you're upset, but it's the child in you that's revving up your alarm, that's sending you into fight or flight, that's putting you in this chronic, adrenal fatigue situation where you just keep drawing on all this adrenaline to keep you going. And there's only a certain limit that you can get with that. You can only, and usually around, 45, that's when people start to crash. And that's when I start seeing them, right? Because they've been pushing it away for so long. And then they kind of come back into themselves. And I show them a different way of doing quote unquote therapy, where they're actually getting at the underlying cause of the issue rather than treating the symptoms with either medication or excessive talk therapy that really, one of the great books out there is called The General Theory of Love by Richard Lannon. And he's a psychiatrist, and he wrote it with two other psychiatrists. But he has this great saying. It's like, insight is the popcorn of psychotherapy, right? So knowing why, like I know why I developed an anxiety disorder, because my dad was schizophrenic and he was bipolar as well. So, there was he was never violent or abusive, but there was points where he was completely psycho. And for a child to see that, it's very destabilizing. So I know where it comes from. I just didn't know what to do with it. And I could have talked about my father's schizophrenia for forever and never actually really healed it.
And if I can try, I want to see if I can summarize kind of a bit of your approach then. So it's not just the thoughts. The thoughts are there. The worry thoughts come up from the alarm, and you're sharing that there's this body memory, there's this frequency vibration, there's some form of event or trauma in the body that's stored there. And so it sounds like your work is you're getting present with the feeling. So rather than using medication or food or alcohol or work to numb it, you're getting present with the feelings. You're really going to observe it. And then it sounds like one of the modalities you like is kind of the inner child type of work, where you go in and start to attach or heal the inner child. Am I kind of getting a bit of your approach?
Yeah, I tend not to try and put a huge label of inner child on it, because it can turn people off sometimes. But just, you're dealing with the alarm. You're dealing with that repressed, unresolved trauma that you keep putting down unconsciously. You're not wanting to deal with it. So we get sucked into our heads and we overthink and we assume the problem's in our heads, when really it's in our body. And I didn't find this out until I did LSD. Like that was the thing that really, on this LSD trip, supervised and medically sanctioned and all that kind of stuff. I wasn't just sort of out in the woods somewhere kind of blowing the back of my head off. But I really saw where my alarm was. It's in my solar plexus. It's purple. It's crystalline. It's sharp. It pushes up against my heart. And I know that that's how my alarm manifests in me. And I know when I get upset, like if my wife and I are arguing about something, that will light up. So that I put my hand on it. I kind of sometimes consciously or unconsciously say, I've got you. And just that pressure, just that feeling of putting your hand over the area where you feel the alarm is soothing. Because when you were a child and you had that alarm and that uncertainty, nobody came along and put their hand on you and said, hey, you know what? It's going to be okay. It's really going to be okay. And then, essential oils, I believe, are really important to bring you into that moment, and when you can get into the moment like that, you can actually do something with the trauma. The thing about worry is it's always about the future. It's always this, protective projection of the future. And the future hasn't happened yet. So you're trying to change a ghost. But the only thing you can really change is if you bring yourself in a sensation and, rub your fingertips together. Sometimes I get people to cross their hands across, and, COVID's a bit different because now you're not supposed to touch your face, but cross your hands, because the brain has such incredible amounts of real estate for your hands and your face. And as soon as you do that, I mean, if your listeners want to try it, it's pretty hard to concentrate on doing anything else because your brain gets overloaded, but it brings you into that present moment. And essential oils kind of do the same thing too. And that's when you can get into the healing part of it. You can't get into the healing part of it with the thinking so much. It helps, and cognitive restructuring is absolutely critical to overall healing. But what I'm seeing is that we have this belief that just knowing why and then thinking about it a different way is going to heal that old trauma. And I'm here to tell you that it's not. I was in therapy for 30 years and it helped a bit, but it really didn't get at the underlying problem. And that's why I wrote the book. That's, I did LSD because I was pretty close to being suicidal. And it was like my back was to the wall. And it showed me that this is where the problem is. And this is where I have to treat. I have to treat this thing in my solar plexus. All this other stuff is superfluous. It's not important. It's connecting with yourself, because all anxiety is separation anxiety. All alarm is separation alarm. And it's really separating from yourself. And that's what happens when we're children. If we have trauma or we have abandonment, part of us abandons ourselves. And you know this as well as anyone else. When the kids, there's a problem in the household, the kids blame themselves. So there's that saying that says, if you abuse a child, the child doesn't stop loving the parent; they stop loving themselves. And then when you get that split from yourself and you lose that innocent self, then everything becomes judgment. Abandonment, blame, shame, and it all gets wrapped up in the same thing. And until you see it for what it is, you can't actually heal it. You have to get in the same room with that alarm before you can resolve it. And all the talking in the world really doesn't get into that same room. You have to be in the same unconscious level. Feeling is one, breathing is one, being in the moment is one, essential oils is one. Just bringing you into that centered moment where you're in the same room with your trauma. Then you can develop a relationship with it. Trying to yell at it from across the river doesn't really help.
The key there is developing a relationship with it. I like that, right?
Yeah, because your relationship with other people can be no better than the relationship you have with yourself. Right. So if you don't have a good relationship with yourself, I have tons of people that say, I've been divorced. I've been divorced twice, married 3 times. I had something going on called defensive detachment, which is a Neufeld term, right? So when I was younger, I didn't trust the love that I got from my dad, because when he went crazy, I kind of lost it. So the message I got was, don't trust love, because it's going to disappoint you or it's going to hurt you. So you can't go through your life with that kind of mindset, because every time you get close to someone, you're going to want to run away. And I had a ton of relationships when I was younger, and when they got good, I ran, because I was just waiting for the other shoe to drop. I was waiting for it all to go bad, like it did with my father. I was just projecting that all over my relationships. And it took me until I was like 50 before I was like, hey, you know what? Maybe you should stop doing the defensive detachment thing. And I've talked about that in the book too. It's just about, developing a new relationship with yourself. And it's not this, hippie, you've got to love yourself. You have to, make sure that you make yourself cups of tea and really take yourself for walks. This is hardcore stuff. This is hardcore, like getting to the trauma and looking at that trauma like, this is the best thing that could happen to me, because it's such a beacon now. Like that alarm, as it comes up, I know exactly where it is. And when you see it, then you can do something about it. If you're in your head, like I said, and the problem's in your heart, and you're in your head, you're never going to fix it. And people don't. And that's why people do therapy for 5, 10, 15, 20 years and don't get any better.
If you ever do an audiobook, I do hope you use your hippy dippy voice.
Well, I'll do that, man. I'll do Schwarzenegger too. Get out, there's a bomb in there. Get down, look out.
I want you to go. We're going to go more into the neuroscience geeky side. We chatted once, and I kind of want you to connect this whole alarm and this anxiety topic around the default network and what's happening in the brain then when people are present and they're able to have this relationship and transform some of this anxiety, and what's happening when we're going down that rabbit hole, we're worrying, and it's taken over, and we're experiencing as if it's happening. Although I'm sitting here in the chair, I'm experiencing as if bad stuff's happening. And you talk about the neuroscience and the default network.
Yeah. Yeah. I mean, before I get to that, I want to just say too, this is something that comes back. My daughter has a little bit of anxiety, not nearly as much as I had, but she said the best thing you ever told me, Dad, was to always say to myself, am I safe in this moment? Am I safe in this moment? Because what happens with anxiety is we're always projecting ourselves into the future and then imagining what it's going to be like when we get into this horrible future. And in the middle of the night, the middle of the day, doesn't matter. But if you ask yourself, I'm stressed now, something's happening, I've got a big tax bill or whatever, but am I safe in this moment, in this moment that I'm in? Am I safe right now? Because a lot of people with anxiety never allowed themselves the luxury of feeling safe because they had to keep up their guard the whole time, that hypervigilance that's really common with anxiety. So it's even if you just notice for a few seconds that you are safe, it almost breaks the spell. And getting back to what you were saying about the default mode network, it's kind of like the daydreaming part of the brain. Like when you're not actively doing something, your brain goes into this default mode network, posterior cingulate gyrus. There's a bunch of stuff that gets used in there. And shame is supposed to be in there, and blame is supposed to be in there. And a lot of self-judgment is in that default mode. So when you're not doing something active and you have this childhood trauma and this alarm in your system, it will default you without you even knowing into this old feeling and this old narrative. And you'll notice that your stories are pretty much the same, and it just you keep going through the same thing. Now, that's why people, when they go to work, if they have anxiety and they go to work, they seem to be okay while they're at work for the most part, because they're out of that default mode network. But as soon as they have some time on their own, or they wake up first thing in the morning, that daydreaming, non-focused state comes up again. And when that comes up again, it brings back all your old shames, traumas, worries, self-blames, defensive detachment, compulsive thinking, all these sort of ego strategies to keep you safe. So what the psychedelics do is, and we can look at functional MRI studies, and we see when we give someone a psychedelic, it shuts down the same part of the brain that shuts down the default mode network. So they have this theory, and I love this theory, is that the ego may actually be housed in this default mode network of the brain. So when you give someone a psychedelic, it shuts down the default mode network, but it also shuts down the ego. So you hear about people on psychedelics, like, I didn't feel like I had any ego. I felt like I was at one with everything. And the other thing the default mode network does is it separates what's conscious and what's unconscious. So there's a consciousness, unconsciousness sort of divide that's present in the default mode network. Now, when you shut it off with a psychedelic, that's why people say, I felt like I could see a purple dragon, or I felt like I was melting into my atmosphere. I was melting into everything around me, because that boundary from the default mode network isn't there anymore. So there's a lot of theory about the default mode network and how we just sort of default into worry or depression or OCD or any of these things. So if we learn that we can focus on something else, specifically bringing ourselves into the moment, because as soon as you bring yourself into the moment, it's kind of like that smelling salts that a boxer gets, they brought back into the moment, and the default mode network shuts off. And then you can actually observe the thought processes. But while you're in the default mode network, you're in it. You're it. We've all been in a situation where we've been, stressed or threatened, and we don't see the forest for the trees because we're in survival brain. And when you're in survival brain, you lose your prefrontal cortex, which is the part of you that allows you to rationally think. Then there's another part that I want to put in the science. There's something called the social engagement system. And this kind of draws on Stephen Porges' polyvagal theory. So superior temporal gyrus, insula, there's a network that goes on. Daniel Siegel calls it the human resonance circuitry. So right now you and I are chatting. It's over the internet, so it's not as, connected as we would be if we were sitting right across from each other. But, we use eye contact, tone of voice, prosody of voice, body language. It's all this stuff that allows us to feel safe. And it starts when we're born. We do this with our mothers. When we're first born, we start developing this social engagement system. And then that social engagement system soothes us. Our mothers soothe us. And when you mature that social engagement system, you're able to soothe yourself. And what's happening now is the kids aren't getting this interaction with each other. They're not face to face anymore. They're face to screen. And they're exchanging oxytocin, the long acting kind of love hormone that you get from a hug, and that's for dopamine, the constant hit, Snapchat. It's always going. So what's happening is that these kids aren't maturing their social engagement system. So as they get older and they get more stressed, they don't have the resource there in their social engagement system to soothe themselves. So what do? They go back to the internet and they go back to dopamine. They go back to Snapchat. They go back to Instagram. So the very thing that's causing their brains not to mature, they're going back to. So no wonder they're full of anxiety. I know that was a long, but I wanted to kind of get into the science of it. So what we're doing is when we're really engaging with our kids, when we're really engaging with the people around us, eye contact, facial expression, the face is the only place in the human body where the skin is attached directly to the muscles, because we can relay a lot of information from smiling, laughing, being afraid, and we're losing that. And as we lose that social engagement system, we go into what's called dorsal vagal, which is basically a shutdown situation. And then we can't use it anymore. If you're shut down, and this is where social anxiety comes from. If you're not able to make eye contact, if you're not able to express yourself in your face, if your body language is stilted, of course you're going to have social anxiety, because when you go in there, it's going to be really uncomfortable. It'd be like if I said, hey, Lorne, we're going to go have a needlepoint competition on Saturday, and we want you to be our lead guy, and you don't know anything about needlepoint. You're not going to want to do it. So I know I ramble, but I'm really passionate about this stuff. And it really is, we really have to get this social engagement system back online and bring it all full circle. The more we build that social engagement system ourselves, the more we can transmute and integrate the alarm that's been, hidden and sequestered in our bodies.
Thank you, Dr. Russ. I really enjoyed that. With these kids, if we're in a pandemic, if we're wearing masks, right now they're using their phones and stuff for their dopamine. So what are some suggestions for people that want to do conscious parenting that have these kids? I think taking the phones away doesn't give them their hit still. So what advice do you have for us to support these kids in that social engagement that you just talked about?
Sometimes I tell parents, see if you can make a game out of, like, this works with teenagers because teenagers hate everything. But younger kids, if you make a game out of, like, hey, let's make eye contact. Let's have a staring contest, and then while you're having the staring contest, start to smile or start to laugh or whatever. And they'll start to laugh too. And then that starts that human resonance circuitry that Dan Siegel talks about. Doing that 3 or 4 times a day gives the brain a chance to move forward. Learning a musical instrument. My son Michael is 16 now, and he loves, Team Fortress 2 or Fortnite or whatever, and he'll play it for hours. So when he was about 11, I got him into guitar, and that musical part sort of matures their brain in a different way as well. So it's breaking that automatic kind of withdrawal, like social isolation that comes from just sitting in front of a computer screen. So a musical instrument's great. Singing is amazing. Singing, chanting, because it does go through that ventral vagus, the part of the vagus nerve that actually calms us down and allows us to be socially connected. And I think it's really important that you just sit with your kids and you do that. I mean, one of the best things you can do is especially with younger kids, is play a game of faces. Like, okay, I'm going to make an angry face, or what kind of face am I making? And you go like this. And it's like, and they'll play because they love, human beings are designed to look at faces. Babies will pick out faces from anything else. And we really love faces. And that's what will help, mature our social engagement system. So that's what I tell parents all the time. get some face-to-face time with your kids. And again, with teenagers, you have to be a little crafty about it because, they hate everything. And but it's really important, especially for the younger kids, to be able to have that face-to-face, eye contact, body language, that connection, every day. And the bridging. The last thing I'll say is the bridging is when even Mike's 15 now. When I drop him off at school, I'll say to him, "Hey, I'll be here to pick you up at 3. We got that new Stevie Ray Vaughan, piece that we wanted to learn how to play. I can't wait to get in there and play it with you." So you're always bridging the next connection with your kids. And that can't be understated enough, rather than just saying, or even at night, even when they go to bed, it's like, "Hey, good night. I'm looking forward to tomorrow when we make, potato pancakes." Or I'll be driving you into school tomorrow and I'm looking forward to maybe we can put that song on in the car that you love to sing to. Now again, teenagers, it was a lot easier when they're, 8 or 9, but you can be crafty as an adult. But the thing is, you really want to engage them, because when you can engage that social engagement system, you can start dissipating a lot of that alarm that's been stored in your system. And we all have it. It's just some people have more than others.
Thank you very much. We had Dr. Russell Kennedy here. Pick up his book, The Anxiety RX for Australians. That's Anxiety Prescription. And so we got Dr. Russ. He's the physician, neuroscientist, yoga teacher, meditation teacher, and comedian. And now we get to add to it, author as well. So congratulations. And it was great to have you on, Dr. Russ. And I'd like to have you back again to talk more about anxiety and, more importantly, how to deal with the alarm.
Thanks, Lorne. I appreciate it. I love your work. I've been following you. I used to live 8 blocks from your place, and I used to use your office all the time. So I appreciate your help.
I appreciate it, man. At AccuBalance, it's mind body. So we're doing that adrenal fatigue, and we're working on the alarm a lot with people. And I'm excited about the work you're doing. And again, thanks for writing that book as well, Anxiety Prescription.